Hello and welcome. Today we're diving into a really fascinating moment in history, a time when Malaysia, a country with a world-renowned public healthcare system, seriously thought about tearing it all down.
And that brings us to the big question we're tackling today. What actually happens when a government tries to undo a healthcare safety net that by all accounts is working really well?
So, to really get what's going on, we have to go back to the beginning. Right after independence, Malaysia built its healthcare system on what you'd call a classic welfare model. It was a promise, really, a promise of care for every single citizen.
And the philosophy behind it was super clear. The government was going to be the main provider and the main funder. The whole point was to make things fair, to use this system to boost the country's development and, this is key, to make sure that people in poorer rural areas weren't left behind. And get this, look at just how incredibly affordable this system was. Because the government was subsidizing it so heavily, back in 1982, a visit to the doctor would set you back just 1 ringgit. That's about 30 cents in US dollars. A day in a hospital ward, 3 ringgit. This was healthcare that was truly, genuinely built for everyone.
And you know what? It absolutely worked. It was so successful that back in the 70s, one analyst, Peter Heller, basically held it up as a model for other developing nations, saying it was this amazing tool for getting resources to the people who needed the most.
But then, things started to shift. By the 1980s and 90s, the official thinking took a pretty dramatic turn. A whole new vision for the country started to emerge, and it called the very idea of a welfare state into question.
The person really leading this charge was Prime Minister Dr. Mahathir bin Mohamad. He just didn't like the idea of a welfare state. His belief was that the main safety net for people shouldn't be the government. It should be a strong, resilient family.
Now, this whole idea was wrapped up in something much bigger, a huge national project called Wawasan 2020, or Vision 2020. The ambition was to turn Malaysia into a fully developed nation, and a big piece of that puzzle was creating this caring society, where the responsibility for welfare shifts away from the state and onto the family.
But it wasn't just about ideology, right? There were some very real practical pressures pushing for change, too. You had the rising costs of fancy new medical tech, a general push to cut government spending, and this growing problem of a brain drain. Doctors and nurses were leaving public hospitals for better pay in the private sector.
But here's the really fascinating part. For all the talk about costs being too high, if you look at the numbers, government spending on health was actually pretty low. In 1992, it was only 1.7% of the country's GDP. That's a pretty small slice of the pie compared to a lot of other countries.
Okay, so the government has this big, ambitious vision. But vision and reality are two very different things, and they started hitting some serious roadblocks. The first, and frankly the biggest obstacle, poverty. Even though the economy was growing, by 1995 you still had about 4.3 million households living below the poverty line. There was just no way these families could afford private healthcare. It wasn't even an option.
And we're not just talking about one group here. There were so many people who were completely dependent on the state system. You had an aging population with no universal pensions, lots of immigrant workers, folks working on remote plantations, not to mention anyone who needed super expensive specialized care like dialysis or mental health care, the kinds of services that just aren't profitable for private hospitals to offer.
And this is where things get really contradictory. I mean, check this out. The government's stated goal was to push services away from the state and toward the private sector. But in reality, when hospitals on these big corporate estates started failing, the government had to do the exact opposite and take them over, just to make sure the workers there didn't lose their health care. And then, of course, there was the politics of it all. Let's be real. The ruling party's biggest supporters were in rural areas, the very people who needed subsidized health care the most. Taking away those benefits, that would have been political suicide. It was a huge risk they just weren't willing to take.
So what happens when you have this grand vision crashing into these huge, immovable obstacles? Well, you get a system that's basically at war with itself. A healthcare policy tug of war, pulling the country in two completely different directions at the same time.
And this just shows you the massive gap between the talk and the reality. On one hand, all the speeches were about privatization and shrinking the state's role. But on the other hand, look at the budget. The actual development plan called for a huge expansion of public health care, with 16 new hospitals and almost 90 new clinics on the books. So instead of one big, clean change, what you saw was a series of these small, kind of messy, and often contradictory steps. They'd give tax relief to encourage private insurance, then they'd try to make public hospitals run more like businesses. But of course, when those corporatized hospitals couldn't afford to serve the poor, the government had to jump back in, even ending up paying private hospitals to open low-cost wards. It was a cycle.
You know, the Director General of the Ministry of Health at the time, he really hit the nail on the head. He said the challenge was figuring out how to balance free enterprise with society's basic responsibility to provide care. And that really sums up the entire dilemma perfectly.
And that's really what this all boils down to, isn't it? The story of Malaysia's healthcare crossroads is about more than just hospitals and policy. It poses a much bigger, universal question. How does any country, anywhere, strike that incredibly difficult balance between its economic goals and its fundamental social duty to its own people? It's a question that's just as urgent now as it was then. Thanks for joining us.